Totally awesome. We are so grateful. We are saying hello to our Live Healthy Miami Gardens family and all of those community partners and our residents that come in with us on every Tuesday at 3 o'clock as we get ready to bring to you our Live Healthy Miami Gardens weekly segment. It's all about the health. And so, for those of you who may be joining us for the first time, we share a little bit about this initiative. The Live Healthy Miami Gardens Facebook Live was absolutely created for the residents and those who live, work, and play around the city of Miami Gardens to bring forth community awareness and the information that would help us to live healthy and whole, mind, body, spirit, and soul. And I am yours truly, Dr. Cheryl Coleman, a part of the Live Healthy Miami Gardens Council host, also the CEO of Abundant Living Health and Wellness Resulting Services, which just comes forth to bring forth health education to make sure that we're healthy on all 10 dimensions of health. And so I'm excited to be with you again on this week. This month is a special month, as every month is. And so with that shared, we know that we're continuing to navigate this post-COVID time in which we're living in. And yes, COVID-19, even though it's declared over, right, nationally, but we know that it still resides with us. And we know that the residuals of it is there. And so as we think about this month is September, and we're focusing on Suicide Awareness Month. Yes, September is Suicide Awareness Month. On Sunday, September the 10th, I had my purple on. Again, we thank God for the fun that we find as we look at how we can identify. But the biggest thing is to make sure that we're educated around this important topic. So I'm absolutely excited today. You're not here with me alone. We have an amazing guest, and that guest that's with us on today is none other than Reverend Lisa Lesor. We're grateful for her presence. She brings a wealth of knowledge. She is the Suicide Prevention Coordinator for NAMI, and I get to be a part and connected with the work at NAMI as one of the health advisory members, and so we're grateful. We're grateful for the connection. She not only serves as their program coordinator, but she is a woman of faith. She's the pastor of the congregational and staff care at the Coral Gables Congregation United Church of Christ. She oversees, guess what? She oversees not just the souls, but those who are connecting with her for mental health. And because that's important in our faith journey. And so we're grateful. She's a part of national work and local work with the United Church of Christ Mental Health Network. She's the board secretary. I'm telling you, she's got a wealth of knowledge and even some experiences that I know that she's going to share with us to help us. We thank God not only is she equipped with faith and she is carrying that out professionally, but she's learned and earned. She has a master's of public health administration from my alma mater, Florida International University. Yay! I knew that we were connected. We are sisters connected together in this work. We're grateful for that work. And she also has the Master's of Divinity from the Chicago Theological Seminary. I shared all of this, not because she wants me to tell you, but I just want you to know what a jewel we have with us on today. And we're looking forward to this time in this segment together as we bring a heightened awareness to Suicide Awareness Month. With that said, I'm Reverend Lesor. You're welcome. We're glad that you're here. And I just want to first maybe start off, and you can share anything that I didn't share about you. You can share that if you will. And you can just probably let us know why it's important for us to bring awareness to this issue around suicide.
Thank you so much for Dr. Coleman for having me here today. And yes, it is so tremendously important that we increase the conversation about suicide, that people understand that suicide is preventable in many cases. We need to get the information out there so that people know how to engage somebody who is perhaps going through a crisis of suicide. And so I want to just talk a little bit about my own personal experience with the issue and what kind of drives my passion about it. And that's kind of twofold. One, I'm somebody who has dealt with suicidal ideation since the time I was a teenager. It's always kind of been my go-to way of thinking in times of stress and feelings of hopelessness. It's something I've never acted on, but it helps me have more empathy for people who are going through those issues because I've kind of been there myself. My second experience was as a caregiver for somebody who was very close to me, who had been somebody who had gone on in their life. They were a professional. They were somebody who was in management, dealing with important things, was very concerned about their appearance, really careful about everything, very meticulous, until one day they weren't. And that was because they went through a mental health crisis, kind of because of some trauma that they had gone through in their childhood that it had never been resolved. And so, as their caregiver, we were able to line up some great doctor team. She had a great physical doctor, physician. She had a great mental health therapist, as well as psychiatrists that were all dealing with what she was going through. But what I discovered through all of that, one day I came home and I found her in the living room in the process of wanting to take her life. And I got to tell you, when you walk in on something like that, it's like the floor just comes out from under you. It's just so shocking. It's so painful to see somebody that you love and you care for in that state of mind. And, in the subsequent weeks to that, thank goodness, we were able to get her help. And then the subsequent weeks to that, I just had all those questions going through my mind of, what was happening in front of me that I hadn't seen up until that point? Why hadn't the mental health professionals talked to me about the possibility of suicide? And so I realized training people to know what the signs of suicide and have these conversations is just so critical. Unfortunately, the suicide rate in this country is increasing. This last year, I just looked at the 2022 statistics, which the CDC is just now kind of coming up with. And it looks like the statistics have gone up 3% since the previous year. So unfortunately, our numbers are going in the wrong direction. And so that's why any opportunity I have to raise awareness and increase those spaces where we can have these conversations, I like to have, I like to step into those spaces.
Wow, it's so and as I hear you talk and share not only the work that you do and the passion around, but the personal testimony that drives your passion around this. And you're absolutely right. It's something that we don't always talk about unless we find ourselves, impacted by it. And so I'm grateful that this month is set aside for us to really, not just this month, we want to do it all the time, but we thank God that we have a national time that's set aside around it. You shared, even your own thought processes and then that of a loved one. And you mentioned caregivers. Caregivers are huge. It's a passion, of course. We have paid caregivers and unpaid caregivers, right? People who are finding themselves post this COVID time that we have. So many people have found themselves being caregivers now who are not trained, who are not equipped, and it's a heavy load and it's a heavy burden on them as well. And so as we share about the awareness of this important topic, and then also the work that we do around COVID, is there any correlation between COVID and the suicide rates that you mentioned just now?
Well, it's interesting because, you would think that the whole time we were going through COVID, that was a perfect storm for suicide rates to increase. We had a lot of stressors. People were depressed. They were lonely. So, when I looked at the numbers, I kind of expected to see this spike in suicides. But what I actually found when I looked at the numbers is that during the time that we were going through the worst of COVID, the numbers actually went down. And what I discovered was that's not really unusual when communities kind of go through these shared experiences, when there's wars or natural disasters, or when we went through 9/11 and we had that kind of shared feeling of community. People were kind of coming together in a sense of camaraderie. We were all suffering on some level, so people didn't feel alone in their suffering. And so while we were separated from each other and we were going through all those things, the actual rate of suicide went down for that particular time. But what we're finding now is the 2 years after, starting in 2001, and now that they're compiling the data for 2021 and 2022, we're seeing it spike. So, and that's also a natural thing that kind of happens after these natural disasters. Life kind of starts getting back to normal. although it's not normal because you're still going through the trauma that you went through, and things are still happening, and you're still trying to deal with that. The one thing I want to mention, statistics can be a little bit deceiving. So, like when you look at the overall statistics, yes, overall the statistics went down during COVID. But what we've consistently seen for like the past 20 years is the rate of marginalized and minority communities, the rate of suicide in those communities going up. So, like even during COVID, black Black communities were experiencing higher rates of suicide, as well as Hispanic communities. Where we were seeing the most significant downward trend was in white communities. And that kind of throws off our statistics because, generally speaking, when you look at the overall statistics, it's the white communities that have the larger number of deaths. But you've got to look at what's going on behind the scenes and dig a little bit deeper to see the trends. And really, for the past 20 years or so, there's been a trend, particularly with young Black males, of increase in suicide rates. And that didn't.
That's interesting as you share those the statistics in the way that they showed up, like when we were actually in the midst of COVID. You're right. We were all hunkered down and sheltered in. And you're right. Natural disasters do have a way of having us to put down some of the busyness of our everyday walk of life. It tends to evoke the humanity side of us, regardless to race, color, creed, religion, right? It's something that happens. And so as you were sharing that, I can see how that would necessarily go. And then as we're lifted out of that and everybody going back into their busyness, well, we're not really paying attention to one another like we, probably should. And we're all trying to, so many things competing for our priorities. And so that really, resonates with me around that whole social and environmental dimension of health. And so I look forward to probably, and I know in our work, and I know as you work with NAMI and as we're connected together and continuing to dive down in that research and looking at the statistics so that we're able to train and equip and educate and empower us to be there for one another when we're hurting. Nobody should be hurting in silence, right? And so we're grateful for that. And as we think about that, and you shared the rise with Black males, what about our youth? I think I was looking at some statistics, and I don't know if it's 10 to 24, and you're the expert, where we see that's like the number one cause of death or something, like I was reading. And so it's not just adults, it's our children.
Oh, definitely. Definitely. We're seeing higher rates of suicide. And during COVID, we saw a spike in suicidal ideation. I saw a study on the CDC where a particular time frame that they compared the first year of the pandemic to the previous year. There was an incredible spike in young girls presenting in emergency rooms with suicidal ideation. We know that 1 in 10, and this is an astounding statistic to me, 1 in 10 of our high school children, young adults, made a suicide attempt last year. That's an incredible number. And then you compound that, because they always say there's for each person who's made an attempt, so many others have those thoughts. Mm-hmm. And so, you think about all the things that are driving that, the bullying, the political environment, increased racism, all those factors that are, impacting our youth, LGBTQ youth who are going through a lot of stuff politically right now in the school system. That all fuels that suicidality that we are seeing. So yes, there is an increase with that. Traditionally, your higher rates of suicide are with our older people over 65, particularly males. Mm-hmm. The interesting thing about suicide is that 4 times as many men die by suicide, yet 3 times as many women make attempts. Wow. The difference here is that when men make a suicide attempt, they generally will use a firearm. So women will take pills or maybe try hanging. But when men do it, they're using a pretty foolproof method.
Mm-hmm. Wow. I am grateful for you being here because, of course, I have my own lived experiences and passions around this topic as well. As you were talking, I was reflecting as a critical care nurse. One of my first code blue actually was a young man, 21 years old, who he didn't just attempt, he was successful. I mean, literally jumped out of the window of the hospital, and I saw it occurring. And as I ran up to do CPR and everything, it was one of the most traumatic experiences that I've ever had. And unfortunately, we did lose him to that attempt. And as I reflect later on, and you have your debriefing, it was about 6 attempts that he made. And I know that as healthcare providers, they have us to do an assessment. And as we do an assessment, I've heard where, as you're assessing, to really take serious someone who can actually say, I got a plan. Because you talked about suicidal ideations. For those who might not know what an ideation, it's a thought, those thoughts that are running through. And then as you're thinking those thoughts, do you have a plan to carry it out? And so I know that probably gets into some of the deep training that you get to do at NAMI. And so I don't know if you want to talk a little bit, about that, whether it's plans or those things that we should look out for, right? And not take for granted.
Well, definitely, I think one of the most important things we need to look out for are the warning signs, and understand that, warning signs can be verbal, they could be behavioral, they can be situations that people go through in their life that make them feel hopeless. And, knowing what warning signs to look for. So like in verbal communication, somebody might be as blunt as to say, I'm want to kill myself. It could be something that, that clear. It could be something like, I don't know how I'm going to go on, or I'm just tired of being here. Something that requires more conversation around, to dig into, to find out more about what's going on with somebody, to make a determination. Is this just something that they're going through? Is this something that requires a deeper level of care and support? And so with NAMI Miami, one of the thing that I do most is I do what's called QPR, suicide prevention trainings. QPR stands for question, persuade, refer. And I do these trainings for free, both online. I do a couple online every month, just through our NAMI and through Zoom. But I also go to community organizations and churches and workplaces to train employees and people that are interested in learning more about suicide and how to prevent it. And it's been a really great initiative. Just to kind of get an idea of how hungry the public is for something like this. This initiative has been in place for just a little over a year. And so last year was our first September Suicide Awareness Month. And I think I did 2 trainings that month. This year I've got I've got at last count 21 that I'm doing. And so people want to know, they're excited to know, they want the knowledge. And they understand that this could really happen in anybody's life, in anybody's home, in anybody's workplace, in your faith community, in your friend group, in your family. Really nobody is immune from the idea that somebody could die by suicide. It impacts, across ethnic groups, across religious traditions, age. There are no real barriers to it.
So grateful for you kind of sharing that, and we definitely, the trainings that you have, I'm looking forward to being a part of one of those trainings very soon, because it's very important that we're able to be educated, and then also not be, those who live with individuals, and for those who might not know, NAMI, the National Alliance of Mental Illness, our mental health, we've been focusing a lot on that, post-COVID, and we recognize, and I get to share on our wellness journey, we're all like one catastrophe away, right, of being in that space where we could possibly be diagnosed with a disorder because of the trauma that takes place in the midst of it. And then also just the pressures of life, right? And so we know that COVID kind of uncovered some things for many of us. And I thank God for that period where we were in and we saw rates decline, right? But now that awareness post is definitely important so we can, kind of stay in that particular space. And as you shared about the thought processes, the thinking, the ideations, those things that go on, I would imagine individuals are seeking and turning, like, where can I find hope in the midst of this? And so I don't know if you want to share some of your experiences or even resources around that, where people are just looking for hope, right?
People are looking for hope, and there is hope. I mean, one of the biggest things I found for hope over these last few years is just that we're talking about it more. So people aren't having to deal with it quietly. I never met anybody who talked about suicidal ideation until about a year ago, when I was at a table with a pastor that I had known for a long time, and she shared her experience. And I could tell you, it was like my ears perked up, because it's like, you're talking about something I've been through. And so the more we talk about it, we increase hope, we increase those connections. There is help. So the primary, the main thing I would tell people, the phone number 988. It's the National Suicide Crisis Hotline. It used to be a long 1-800 number that people couldn't remember. They had this whole initiative to shorten it and make it something simple so that people could remember. So if you or somebody is going through a crisis where suicide or any mental health challenge is coming up, and you need help, you need guidance, call 988, because they have trained professionals that will answer your call. It's a national number, but it gets routed to a local number that has all our local resources. So you will be guided to whatever resource is appropriate in your particular instance, and it will be right there in your community. And of course, we know that sometimes, if somebody's, they're deep in crisis and they're actually in the process of making a suicide attempt, or they have a weapon, always call 911, but ask for a CIT trained officer, a crisis intervention team. Those are the officers that have had extensive training on how to deal with somebody who's in crisis. They know exactly how to proceed, so that we don't see some of those tragic outcomes that unfortunately we've seen too often when family members are desperate and they call 911. Asking for a CIT trained office, crisis intervention team, will mean that you're going to get a professional out there who knows how to handle that situation. There's also another resource. There's a mental health mobile unit that's run by West Care. It's for all of Miami-Dade County, and if you happen to be in Monroe County, they have another one. I can't remember who runs that one, but it's the same kind of idea. If you're having somebody in your home, or you yourself are having a mental health crisis, not to the point of making a suicide attempt, but maybe you're having a bad reaction to medication, or you're dealing with severe depression and you need additional help, you can call that number for the West Care mobile unit, and they will come to your home. They'll come to your workplace. They will come to your faith community. They will come within the hour, and they'll do an assessment, and they will decide what the best course of action is for you at that time. I wish they had that years ago when I was dealing with my family member, because in that particular case, she did end up getting Baker acted, and it ended up not being the nicest experience, and not that being Baker acted ever would be, but perhaps there was a different way to handle it. So I'm so glad it's there for our community now.
Awesome. I'm grateful, and I'm grateful for those resources are there, and then uplifting and highlighting, because we know 911 for those emergencies, but 988 now for our suicide hotline is the new thing. We got to make sure everybody knows 988. Reverend Lesor, you're a wealth of knowledge. We do have, and I want to acknowledge Sherry Williams that's on and watching, and her comment says, what about the silence and the withdrawal behavior? And how does, and I don't know in your experience, or if that's one of the heightened awarenesses. I know it's a part of depression, and if we don't get depression under control, right? we can go down. I
Definitely.
don't know if you want to mention anything around that. I saw that comment. We wanted to uplift it.
Well, definitely that can be a sign. It is one of the warning signs that somebody may be thinking about suicide. And I always like to say maybe, because you're really not going to know until you start having a conversation with them and start trying to, dig in a little bit deeper, find out what's going on, show your empathy, your compassion, show that you're somebody that they can trust with this information. Because we're just getting to the point where mental health itself can be talked about a little bit. We're kind of bringing it out of the shadows more, um, but it's still a lot of stigma, and so it's better, if you can just be patient, persistent, and just show that you care, and see if you can get somebody to open up to you.
That's the power of active listening. And I know with my social justice faith in Florida hat, we're in the year of listening, right? And a lot of times we want to run and we want to make a difference with all good intentions, but we've got to hear. And as we hear, then we're led and being able to empower, equip, and journey along with people in this life, right? In this journey of life. And so we're grateful. Of course, you and I have our faith background. And we know the church is the one place that I don't care what your denomination is, where you are, oftentimes people come there for help and for hope in various situations. And so, again, I don't know if you want to uplift anything, but being able to find a safe space to just share can make the difference. It can make all of the difference. Thank you. We do have a down there, our NAMI, and she's our coordinator, and that 988. And I did see Jockey the dancer who's watching with us says, yes, I will make sure I spread the word. Call 988. See, listen, if we do nothing but get those little nuggets out there, and again, sparking the conversation, it's powerful in making a difference. And so I'm just checking to see that we don't have any other question or comment. We do see Miss Sherry that says, thanks for the very good answer and advice. And so we thank God for those who are watching with us now live. And again, this is Live Healthy Miami Gardens weekly, coming through and sharing information. This just happens to be our faith and wellness segment. And we're grateful for having this time. We want to honor your time, and we're almost, when it gets good, it's time to end. I'm so glad we had this time together in my Carol Burnett voice. So with that shared, Reverend Lisa, I don't know if there are any final parting words. We're grateful for those, again, who are listening. We're grateful for the Live Healthy Miami Gardens health initiative. I am a resident of Miami Gardens, and I'm so grateful that we have a city that's looking forward to making sure that we have the things that we need to be healthy and whole, mind, body, spirit, and soul, whether you live here, work here, or play here. Amen. Reverend Lesor, any final parting words for you?
I would just tell people that if they want more information, NAMI is here for them. NAMIMiami.org is our website. You can find my contact information there. You can also find out more information about our Black Communities Initiative, our support groups, which we run online. For all of this is free for the community. And, it really can be transformative for people to find a place where they can get help.
Awesome. Well, thank you so much. I do know in the Abundant Living Health and Wellness monthly newsletter, we have uplifted our Suicide Awareness Month as a highlight. We know every month there's a list of them, but this month we singled that out, and we would love to, if there's NAMI information that we can put out for trainings, we definitely want to partner as a collaborative, just like I collaborate with Live Healthy Miami Gardens. And then I have my social justice faith in Florida hat. I wear every hat, any hat I can wear to make sure that health information gets out. We're glad to do it. And so I believe that is our time today. Our Live Healthy Miami Garden family, let's give it up for Reverend Lisa Lesor, and let's thank her for her time and her expertise in sharing with us on today. And we are going to be signing off. And we say thank you, and having an amazing rest of your day. Signing up.
All right.